This segment of the Plastic Surgery Channel is brought to you by Galatea, now offering Galaform, the first 3D mesh for soft tissue support.
Dr. Bill Adams here, and do we have a show for you today? No Spin Live. We're going to talk about misnomers and death, new devices for breast reconstruction, and white lies from a supermodel. With us here today, we've got a great group of plastic surgery experts. We have Dr. Jason Posner from Boca Raton, Florida, Dr. Dan Del Vecchio from Boston, Massachusetts, in the car, mobile as usual, Dr. Jason Cooper from Jupiter, Florida, and Dr. Kevin Smith from Charlotte, North Carolina. So guys, everybody's talking about this. We got to visit about this for a second. Roger Goodell comes back for his negotiation. He wants $50 million per year, plus a private jet for lifetime, plus lifetime health insurance. What's up with that, Del Vecchio?
Well, you always start high. You can negotiate down. I do the same thing. I mean, I'd take like an annual subway pass in Boston. I don't even have that yet. So I think the guy's doing the right thing by aiming high.
Aiming high? Wait a second. He's like in the stratosphere, Kevin, isn't he? I mean, like, what planet is he on?
Well, there's one born every day, and if people buy this, then more power to him if he can pull it off. But it's ridiculous. Whose worth is that? The health insurance is probably worth more than the plane.
And Jason, is that the owners there's this thing back and forth, but is Jerry Jones the only sane one? He's the one trying to put the brakes on this. But, I mean, what owner in their right mind would even consider that offer?
Jerry Jones is doing the right thing. Jerry Jones is trying to tie the productivity of the league to Roger Goodell's compensation, which is the right thing to do. Whether or not he's successful is to be determined, but that's what you have to do if you want to make the league profitable over time.
Well, more to come on this, but let's get into this and talking about doing the right thing or wrong thing. This first story is out of the Fresno Bee. They went to a plastic surgeon to improve their looks and they wound up dead. But I think there's more to the story and I think we should talk about it. So Kevin, lead us off.
There's really two stories here. One, the fact that this guy calls himself a plastic surgeon and is in actuality not. And the other part of the story is we plastic surgeons, even in the best of hands, can have complications. So plastic surgery is something that needs to be taken seriously. In this case, Dr. Yoho is a fellow who is board certified in emergency medicine. I looked up his credentials and he had a year of internal medicine internship. He had a year of dermatology and 2 years of emergency medicine. Never has he done a surgical residency. And this guy claims that he's board certified in cosmetic surgery. He's doing aesthetic or cosmetic surgery for patients, and the outcomes are not good. So people need to do their due diligence and really take a good deal make a good deal of effort to find out these guys, if they are actually board certified, where they have their privileges, and some history behind these guys. Are they really properly trained? That's one of the biggest questions that this raises.
Jason Posner, so cosmetic surgeon, that's the worst term in the world. I mean, and no wonder people are dying over it. I mean, don't you think this is it's tragic, but the whole thing's a gong show?
Yeah, I mean, Kevin covered this pretty extensively with his previous comments, but we've been through this plenty of times on this show before. We go through a lot of hoops to become board certified plastic surgeons to do these procedures, and a lot of people are nipping at our feet because they want to be us without the training. And again, it's up to the patients to do their homework, to really go to board certified plastic surgeons for plastic surgery. If it's fillers and toxins, there's a lot of options. But for plastic surgery, you need to go to a board certified plastic surgeon.
To me, it bothers me a little bit that the government or the regulators, whether it's in this case, the California State Board, but the Texas State Board does the same thing. Aren't they kind of bound to protect the public? And why in the world would they condone? Because that's what they're doing. They're condoning people that aren't trained in surgery to do these things. And to me, that bothers me because I think they should be protecting the public, and they're not.
Well, there's a huge problem with public perception and who's protecting whom and what our board's responsibility is to get involved with the legislators to, basically abolish this stuff. The problem is No one knows. It's like will the real board member please stand up? The public doesn't know because these people are saying they're board certified in cosmetic surgery. So the public goes out there, they think they're going to see a board certified plastic surgeon or cosmetic surgeon, and they don't know who the real person is. They don't even know who they should see.
I totally agree with you. I totally agree. You know, it's not that we can say it till we're blue in the face. The public doesn't have enough background to be able to make that decision. And that's why I think regulators need to come in and help the public out. In fact, in Australia, we just talked about this on another show, they've already started doing that. They started regulating these people calling themselves cosmetic surgeons or whatever they want to call themselves without any training to even do surgery. Del Vecchio, what say you?
We've had this conversation before. It's going to be tough for the regulators and the legislators to do because the physicians are going to fight back. It's a shame because patients die. We see this monthly. The thing that's really profound is there are patients who are willing to pay for this. And it's kind of like the high-end eye effect, which is why I think home laser vaginal rejuvenation probably has a real role. Because if there are people willing to pay for this type of surgery, there are people who want to have laser vaginal rejuvenation at home.
Yeah, well, I don't think this will be the last time we talk about this, but to me, it's an atrocity. You know, in fact, I think that the state boards are worried about legal action against them for restricted trade, and that's, you know what? Wait till some attorney is going to class action file suits against the government because the government needs to protect the people. At the end of the day, that's what the government is there for. These guys have no surgical training. Hell, you can't do your commercial airline pilot without certain hours of training. It's just wrote in the regulation, you know. So I don't understand why that can't happen in our specialty. So let's go to the second topic. This is it's a new device for breast reconstruction. Sometimes when we do breast reconstruction, we expand the breast with the expander. Typically, you inject that with saline through a transcutaneous needle stick. So this is a automated filling, if you will, of an expander using a CO2 cartridge. Jason, what do you think about this?
You know what? I don't currently perform breast reconstruction in my practice, and I'm going to let maybe Jason Cooper, who does a lot of this, get a little bit, expound on this a little further. But it sounds like a good idea to me. It sounds like it needs to be tested a little bit more. But especially for those patients who don't live near the doctor doing the reconstruction, I think it's a great option for those patients. So far, what I've seen sounds good to me. So I'll give it a thumbs up provisionally.
Jason Cooper, what do you think?
I think it's a good idea in practice for the remotely located patient. I think just caution should be, I personally have not used this device. So I want to, say that as a disclaimer before my comments. But look, I think it's a good idea in principle. I think it needs to be qualified with, it's always really important for patients to see their doctor during the expansion phase. And when patients are at home, sort of experimenting with expansion once a day, twice a day, or 3 times a day, things can arise. And I think it's really important to have a connection with your plastic surgeon during that time period so that they can monitor you and they can ensure your safety and the best outcome.
I guess to me, you got to qualify a little bit. How big of a deal is it? This little tiny needle that we use to put in saline to expander. It's never really. I don't remember ever patients complaining about that. But what do you think about this?
Well, they've never complained about it because they've never really had a choice. But anytime you can avoid getting stuck, I think that's a good thing. None of us like needles, and I think Jason was absolutely right about this is a neat device. It's something that allows the patient to expand themselves, but I think it's really important that they be supervised in doing so. The last thing that sort of makes me lean towards thinking this device is neat is that anytime we introduce a foreign object through the skin into an expander, there's a risk of a deflation, there's a risk of infection, and that can start the reconstruction all over again. So having a contained device that doesn't have to be stuck with a needle may have an advantage. We'll see how it works out in the long run.
DDV, what's your perspective?
It's interesting, but is this like groundbreaking news? No. Is there this unmet clinical need for people who are not wanting needles? No. Is it neater? Yes. it's an interesting thing, but this is not some huge, sea change in reconstructive breast surgery. And to me, it looks more like an infomercial for those who are included in it.
All right, well, I think there's some good insights, and time will tell. We'll certainly gain more experience with this in the future. All right, our last story is on the lighter side. I think Sports Illustrated model Chrissy Teigen apparently said she had a bunch of things done, cosmetic surgery, plastic surgery, and then somebody put that out there on social media, and then she was upset. Del Vecchio, I mean, I can't even understand what she said. She's going back and forth, flip-flopping. What's the deal?
She likes cosmetic surgery, but she's also embarrassed about having it. Hey, everyone is having cosmetic surgery. What's the big deal? And why is it so important that a celebrity has or it doesn't have it? To me, it's like, what's the big deal?
I don't know. Jason Cooper, I mean, if she's going to joke about something on social media, what does she expect to happen?
I think she should expect to happen kind of what happened, and I think it's her right to kind of pull back. Look, if she's not comfortable talking about it or confronting it at this time, like, that's fine. I don't think it's a big deal either way. Sometimes people are just not comfortable talking about things that they may have had done, or they feel insecure about, or they're just not ready. So fine by me.
Yeah, Kevin, I mean, what's your insights into this one?
It's amazing that the media, either the shiny, glossy magazines or social media, they demand beauty, and yet they demean people who seek it. It's really kind of crazy and a double standard. What difference does it make whether she's had something or not? It's her choice. Lay off. This is a personal decision.
Jason Posner, you're going to have the last word, but it's just yet another attention grab by some pseudo celebrity or supermodel or whatever.
Yeah, I have the last word. Two things. Who's Chrissy Teigen and who cares?
There you go.
There you go. All right, well, I tell you what. Great insights, guys. I know our viewers are going to really take a lot away from this show. Appreciate your time. And if you want to see more of this, you can see it on theplasticsurgerychannel.com.